A couple of things. First of all, are you optimistic that we will, in fact, come up with an effective vaccine for this virus? And secondly, you've mentioned this immune type therapy, transplanting plasma and immune cells. Is there any possibility that that might turn into an effective treatment for the virus as well?
So I'm very hopeful for a vaccine. Since humans do develop immunity to this virus, it seems that it's within reach. So there's viruses that we haven't been able to develop vaccines for, such as HIV, but that's mostly because the human body doesn't develop really effective antibodies to those viruses. You know, you don't get cured from that pathogen like you do with COVID-19. And so yeah, so there's a lot of hope. There's 100 some trials underway, and so that's, you know, just sort of rolling the dice. That's a lot of, you know,
Right.
hopeful opportunities. They're attacking it from lots of different angles, and so that's also, you know, hedging our bets, and hopefully we'll get a good outcome. Um, then the next question is, well, if we're unable to develop a vaccine, that's sort of the best thing, because we can disseminate that and then everybody can be immune. Can we use this plasma, or can we develop antibodies that are based on the antibodies that our humans naturally create to combat this disease? Can we use those things to treat COVID-19? So this convalescent therapy, this plasma-based therapy, is being used, and it's pretty effective. It's not 100%, but it is pretty effective. It reduces the mortality rate of COVID-19. The problem with that is that this is very hard. I mean, this is where a human that knows that they had the disease goes and donates plasma, and then that goes to a patient. And we already have problems with blood donation and things like that anyways. And so that's a solution that doesn't scale very well.
Okay.
But what people have done is they've taken that plasma and they've identified antibodies in that plasma that are effective at attacking the virus. And so we can actually create those antibodies pretty easily in industrial cell cultures. And so people are doing that. There's a lot of research on identifying these antibodies, coming up with protocols to create them in mass volume, and then to use those. These are, if you ever hear about, they're kind of a controversial classification of drugs, biologicals. This is a biological drug. So it's not synthesized through chemistry, but is created through components of biology to use. Biological drugs are controversial, not just because they're a new kind of class of drugs, but because since they are biological compounds, you know, biological structures and so forth, they could elicit immune responses themselves, which would be really bad if you gave it to a human. But these ones seem not to have any bad effects so far on patients. So there's a lot of hope with that as well.
Is there any way to get on top of this virus other than, as I understand it, and again, I hope you'll correct me if I'm wrong, but vaccine or herd immunity are the two things that I've heard about. Given what we've done in this country, which seems to me to be pretty much the worst of all possible responses to the virus, let's have a shutdown and a quarantine, but not really. And then let's cut off the shutdown and the quarantine so that we can, quote unquote, restart the economy. And now we're seeing what the repercussions of that are. Is there any way to get on top of this, or do we just have to wait for a vaccine or wait for herd immunity to take effect? You know what I mean?
Yeah, so there's three strategies. The third one is to track it and isolate people and to stop it in action. So certainly New Zealand has been successful with this. Europe has been much better at this, and certainly South Korea is sort of the prime example. But even in South Korea, as they sort of relaxed rules, the virus did have a couple new outbreaks. And so yeah, so Uh, our country, we've taken a different approach. Sweden has taken a different approach where we're just okay with, a certain level of spread of this virus. And so our strategy so far has been to hopefully keep it at a level where we don't overwhelm our healthcare system. So that flattening the curve, that is a good message. I don't know if it's necessarily the way that I want to handle the virus. What that means is that you just want to slow down its spread to a level where you don't overwhelm your hospital systems,
Right.
but it does still spread through society and spread from person to person until you reach this level of herd immunity. The problem with herd immunity is that you have to get about 50% of your population to have been exposed to the virus in order for the entire population to then develop this herd immunity. What that is referring to is that right now the virus is able to spread so quickly because there's so many susceptible people to the virus. And so each infected person interacts with lots of susceptible people and it spreads very rapidly. At some point, though, if so many people have already recovered from the virus, then when an infected person is infected, doesn't know it, and is spreading the virus, it's often spreading. They're often spreading the virus to people that have already had the virus, and so those are little roadblocks for the virus, and they slow down the ability for that virus to spread, and so you develop this population level immunity. It's not an individual based immunity; it's a population based. But basically,
Right.
it's just there's so many roadblocks for the virus that it can't spread in the population. So that is predicted to happen about 50% of the population has immunity. Well, that's an extraordinary number of people. That's over 150 million people
Right.
having had this disease. And they're estimating that the mortality rate is, about, we'll say 0.5%. It might be about 0.4%, but 0.5%. So that's still millions of Americans who will die if we rely on herd immunity. And I just don't think that's acceptable, although we're marching down that road. I mean, we are over 100,000. By the end of summer, we'll be at 200,000 deaths. I mean, yep. So hopefully we get this vaccine and basically we can create herd immunity without people actually getting the disease and dying from the disease. But that vaccine, the fastest we've ever created a vaccine was in 4 years. That was a long time ago, so hopefully our technology is a lot better now, and so we can speed that process up. But a lot of vaccine creation depends on just luck, and so hopefully we're lucky, but maybe we're not, and it might take more than a year or so to create.
Well, Donald Trump says that we're going to have a vaccine for it, and it's going to come from the same people who created the AIDS vaccine. That's his theory. Have you heard that?
Well, then I'll sleep better tonight knowing that.
Yeah, he missed something there. First of all, he doesn't know that AIDS isn't the virus.
Right.
And he also doesn't know that there's no vaccine. But if we had had strong national leadership at the beginning of this that said, I don't want to oversimplify it, but something along the lines of, look, we got to get this thing. Everybody stay home. Go get what you need for the next 3.5 weeks or whatever it is, and stay home. What would have happened?
Yeah, we would have had. So there are epidemiologists that have mathematical models to predict these different circumstances. These different realities that we were not lucky enough to be in, thousands fewer people would die. Millions less people would actually get the disease. So this virus we know is actually really sensitive to the external environment. It's very good at infecting cells. It's very bad floating around the environment. It's affected by temperature and UV light, and if it lands on a surface and dries up, it falls apart. So I think people think of this as sort of existing, somewhere hiding out and getting ready to sort of reemerge. But this virus can't hide. It dies when it's outside of the human body. So this virus relies on people spreading it from one person to the next person. It relies on that chain. If you break that chain, it can't go anywhere. So if we really, all of us, and the infection cycle is about a couple weeks. So if all of us would have stayed home for a month, not left our houses, not interacted with anybody else, it would have gone away. I mean, it would have gone away. Obviously that we can't do that. We need some sort of vital services. But and so maybe it would have just gone to really low numbers. But if it's at really low numbers, then you can easily test for it and track it and keep it under control. And that's what other countries have done. We haven't done that, and so we are dealing with a much larger epidemic or pandemic and much more death than we need to experience.
What kind of precautions do you take? When you go out in public, do you glove and mask up? Do you worry about do you worry about surface contact when you grab an item from the grocery store or something gets delivered to your house? Do you wipe things down with Clorox wipes or something like that? What do you do?
Yeah, so I limit leaving. I limit going to places where other people are as much as possible. So I try to make my grocery store trip last longer than it normally would. But I still do go to the grocery store. I work from home now. I lecture from home. I write from home. All of these things. I manage my lab from home. So that limits my interaction with people. I have a dog that likes to go on lots of walks, and I freely go outside with that dog and go on walks. And I don't tend to wear masks during those walks because I stay well away from people. My dog is a little skittish, so she really likes social distancing. She doesn't like encounter people, so she keeps us naturally away from people anyways. Certainly if I go to the grocery store somewhere where I'm going to be near people, I certainly wear a mask. Surfaces, at the very beginning of this, they thought surfaces were the main way that it got transmitted from one person to another person. But that doesn't seem right. That it seems like it's more of these aerosolized particles that are transmitting. But I do still take precautions. I wash my hands a lot, and I do wipe off surfaces with disinfectant. I wonder sometimes whether or not that's really critical, but we might as well. It's easy to do.
Right.
Yeah, I think in general, what I tell people to do is, number one, don't be the guinea pig. I mean, it's so obvious. When something opens up, don't be the first one in line.
Yep.
Like, why did you do that?
Yeah.
Of course, this strategy relies on somebody else being the first person in line. But just for the people that I know, don't be the guinea pig. The other thing is we are going to be living with this for a while. And so you have to come up with a strategy where you're going to maintain sanity and keep yourself as safe as possible. Where that line is going to be different for each person. But you really do have to think about this as sort of a 6-month plan. How could you adjust your life to limit interactions with other people, but for the next 6 months in a way that you're still going to maintain your sort of mental health? And so each person has to think about that, be as conservative as possible with their interactions with other people, limiting them as much as possible, but not driving yourself completely insane. Because what I fear is that people went overboard, couldn't handle it, and then now, months later, they are forgetting all of the rules because they just had a sort of a meltdown. And so you want a strategy where you maintain limiting interactions with people, but not so much so that you're going to melt down and then throw out all the rules. So I think, there's no way to be 100% safe, and there's no way, but there are lots of ways to really reduce your exposure and reduce that community spread to other people.
You mentioned 6 months. I'm sorry, go ahead, Brendan.
No, I was going to ask, as a scientist, do you have any thoughts about whether it would be wise to, let's say, spray your lungs with Formula 409? Wouldn't that?
Or inject yourself with Clorox. I've been wondering about that too. Any ideas on that?
Yeah. The why viruses are so hard to fight is that they use our own cells to reproduce. And so most things that kill viruses will also kill us because they're using us to reproduce. And so the sort of problem that scientists have with viruses is finding that Achilles heel that just kills the virus and does not kill us. right? And so there are a few, they only have a few proteins, and so there's only a few ways that we can really attack them so that we don't hurt ourselves. And clearly, bleach hurts us. And why you would ever think that that was reasonable is, I mean, you got something going on with yourself.
Boy, I'm so disappointed to hear that. I really was hopeful. I talked about, injecting bleach. I thought, man, we are on it. We have got it. But no, you're saying no. You scientists, I'll tell you, you're nothing but buzzkills. All you scientists. You really are.
Yeah. These facts, why, they
really stand on need to be some type of facts.
Dan, I think you had a question that was a follow-up one that I thought could go somewhere.
You mentioned 6 months, and I'm wondering why that time frame. And I am genuinely curious. Do you think that, because quite frankly, I don't plan to go out or do anything significant outside of the house until 2021, and so I'm wondering, is that grounded in observations that you've made? What's your thinking on how long it will be before we get back to quote unquote normal?
Yeah, so the 6 months was probably less based on the development of technology and science, and more based on my thinking about human psychology more than anything else. 6 months is a long time, but it's not like you can envision what life will be like in 6 months. It's not
Sure.
So terrible. And so I think that's why I chose 6 months. It was pretty arbitrary. We do know that vaccine trials are underway, and so maybe we will have an effective vaccine that doesn't have too many bad side effects. In January, so around 6 months from now. But that's being hopeful. And when that vaccine actually is produced at scale, so that we actually have access to it, is another question. And also, which country does that vaccine get developed in? Is it a vaccine by the WHO? Do they want to share it with the United States, who has been acting like such an asshole to everybody?
Yeah, now that we're no longer friends with the WHO, they may tell us to go spin on it, right?
I was keeping her out of the room, and so she was kind of upset, but yeah.
She seems entirely unimpressed by our conversation.
She's a loving dog, but she has her own priorities.